Hey everybody, I'm Waqas. I'm a first-year medical oncology fellow, University of Chicago, and today I'll be talking about a trial that looks at Ponsegromab, one of the recent drugs that's been studied for treating cancer cachexia. If you go back to Hippocrates, we all learned about the Hippocratic Oath during med school, but Hippocrates also characterized cancer cachexia, which he described as flesh being consumed and becoming water. Cancer cachexia is defined as reduced dietary intake and also altered metabolism. There's a lot of different ways you can break it down, but clinically it's defined as a weight loss of 5% over the course of 6 months. And despite cancer cachexia being recognized for over 2 millennia, we don't actually have any FDA-approved treatments in North America or Europe for treating this condition, for treating the weight loss and muscle wasting that we see in cancer patients. So today I'm going to talk a little bit about this trial that was a phase 2 trial published in the New England Journal of Medicine this September that talks about the trial results for Ponsegromab. Ponsegromab, before we kind of go into sort of the trial, I want to talk a little bit about the pathophysiology behind it. So this trial centers on GDF15, which is a cytokine protein that's frequently overexpressed in cancer. And this protein specifically expressed or is acts on the brainstem, which is it's specifically in the area postrema and also the nucleus of the solitary tract, where it basically suppresses appetite and induces nausea. And if you look at a lot of different chemotherapies that are metagenic or that also can contribute to nausea, such as platinum chemotherapies, you have a perfect storm of elevated GDF15, both from your cancer treatment and from the cancer itself, that really can harm patients' nutrition. And so ponsegromab is a humanized monoclonal antibody, meaning that it's designed to inhibit the GDF15 cytokine protein and targets this pathway while also minimizing immune reactivity. And its development represents a breakthrough in our understanding of how cancer affects appetite, regulation, and metabolism. So, in terms of the trial itself, it was a trial of 187 patients. It was randomized, it was placebo controlled. It had patients with advanced cancers of either the lung, pancreas, or colorectal cancer who had measured elevated GDF15 levels. And so participants were either going to receive the placebo or they received the ponsegromab drug at doses of either 100, 200, or 400 milligrams. And it's a subcutaneous dose, and then it was done every 4 weeks. And the really nice thing about the trial was how the endpoints were designed. You had really comprehensive endpoints, with the primary endpoint looking at how much weight the patient gained or lost over the course of the trial, but also secondary endpoints looking at things like measuring appetite, looking at different symptoms of cachexia, and also digital markers of physical activity, like how many steps and the amount of physical activity that a patient had in a day. And the results were striking. After 12 weeks, patients on the highest dose, on the 400 milligram dose of the ponsegromab, gained a median of 2.81 kilograms more than the placebo group. For us Americans who aren't too good with the metric system, this is about 6 pounds. But this weight wasn't just fluid weight. The trial also measured lumbar skeletal muscle index, and that also increased significantly compared to the placebo group as well. But the other important finding was that in the 400 milligram group, the quality of life was also increased compared to in terms of looking at physical activity, which increased by 72 minutes compared to the placebo group. And the effects and the improvements in the ponsegromab occurred with minimal treatment adverse related events, which was also important. And we also saw the increase in weight among all three doses of the ponsegromab uh, treatment arm. In terms of discussing the drug with patients, it's not FDA approved yet, but I think it's important to really talk about the idea of treating weight loss and treating appetite within the context of comprehensive cancer care. And so what that means is that ponsegromab isn't going to directly target or cure the cancer itself, but it does improve a patient's ability to tolerate chemotherapy and maintain quality of life. And this is going to become increasingly relevant and important as we see increasing survival in cancer, as we see more patients entering cancer survivorship, where they're being monitored for recurrence of their cancer, and also as we see more patients living longer with stage 3, stage 4 disease that's incurable, but kind of treated like a chronic condition. So definitely important for those patient populations as well. So in practice, I would approach the discussions about cachexia by emphasizing that maintaining weight is not just about comfort; it's about putting patients in the best position to tolerate and undergo cancer treatment. And I think the really nice thing about the trial was that the measurements of digital activity really show that there's concrete evidence that cachexia is that treating cachexia can also help patients perform their ADLs or daily routines and help them maintain some semblance of independence as they undergo very trying time in their life. In terms of future implications, these results are definitely very promising, but there's a lot of several questions that remain, right? First thing is that, this trial was placebo controlled, so it wasn't a head-to-head trial with other drugs that we use for weight loss or appetite. So in the clinic, patients will be on things like low dose steroids, they'll be on mirtazapine, which is a antidepressant that can help with appetite, or even Megace or megestrol acetate. So it'd be interesting to see how Ponsegromab compares to some of these drugs that are used for treating cachexia. And also, GDF15's been seen to be elevated in other conditions as well, like heart failure, HIV. So it'll be interesting to see if this drug can be used in non-cancer indications as well. But overall, I think that the success in this trial highlights the importance of trying to research how cancer affects the function of the brainstem and also how it regulates our appetite. And as we move towards more personalized treatment approaches, understanding these mechanisms are going to become even more optimal for patient care. So as we kind of close, I would say that, even though we've kind of recognized cachexia for basically 25 centuries, for 2.5 millennia without effective treatments, this trial of Ponsegromab represents a big step forward, especially for patients with advanced cancer of the lung, pancreas, and colorectal cancer, and shows that targeting specific molecular pathways is addressing comprehensive cancer care, not just in terms of, like treating the tumor, but in terms of maintaining the overall well-being of the patient.